Welcome to this briefing on the COVID-19 pandemic in the region of the Americas. I'm Sebastián Oriel from the Communications Department of PAHO. And today we're transmitting live via Zoom. As I said, we have simultaneous interpretation into English and Spanish. This session can also be found in our social networks on Facebook and Twitter. We remind you that this session will last 45 minutes. It will be 11:45 today, this morning, Washington time, and we will answer questions up until then. So you can send us your questions via email or via the chat. Today, PAHO Director Dr. Carissa Etienne will report on the current situation of the pandemic in the region. With her, Dr. Jarbas Barbosa, the Assistant Director, Dr. Ciro Ugarte, Director of the Health Emergencies Department, Dr. Espinal, Director of Communicable Diseases, and Dr. Silvana Ligeti, Assistant Director of PAHO Emergencies and Manager of the COVID-19 incidents. So I'd like to invite Dr. Etienne to say her opening words. Dr. Etienne, please.
Hello, and let me thank you for joining us again for another weekly media briefing. This week marks a somber milestone in the fight against COVID-19. More than 1 million cases of the virus has been reported in the Americas as of 27th of April. More than 60,000 people have died from this terrible disease. And there has been a concerning rise of new infectious cases across Latin America. Just in the past week, we've seen over 250,000 new cases in the Americas. The majority of new cases were reported in the United States, followed by Brazil, Canada, Ecuador, and Mexico. All countries and territories in the region have confirmed cases, and we are seeing a growing number of countries with ongoing community transmission. 3 in North America, 7 in South America, 1 in Central America, and 1 in the Caribbean. As testing increases, countries are starting to update their numbers to confirm what we have long expected, that the burden of COVID-19 in our region is greater than what health authorities have been able to report in previous weeks. PAHO continues to work closely with its member states to strengthen surveillance. Based on everything we know, it is vital that countries reinforce protective measures now and use all tools available to them. This includes proven public health interventions like social distancing, testing, isolating cases, and contact tracing. This situation with COVID-19 would be very different if we had an effective vaccine against the disease. Some of the best minds in our region and around the world are focused on developing a vaccine for this novel coronavirus. And we are encouraged by the unprecedented collaboration towards this shared scientific goal. This week, however, is Vaccination Week in the Americas. It is a time to promote and celebrate the life-saving power of vaccines. And in 2020, we approach it with an acute sense of urgency. Until a vaccine for COVID-19 is available, immunizations can and must be delivered by the health services alongside the response to COVID-19. And this is why. First, we must vaccinate to protect health workers, the elderly, and vulnerable populations from other respiratory infections, such as influenza and pneumococcus, which can lead to more hospitalizations and may be harder to diagnose in the context of COVID-19. Second, if we fall behind on routine immunizations, particularly for children, we risk outbreaks, thus overwhelming hospitals and clinics with preventable diseases, in addition to COVID-19. The impact on our health systems would take months or even years to reverse. This region has shown great capacity to ensure that its people are vaccinated. And we must maintain this capacity now, but also to ensure the readiness to deliver the vaccine for COVID-19. History has shown us that after wars or epidemics, if we allow large gaps in immunization coverage, vaccine-preventable diseases like polio and measles can re-emerge. Let me remind you that measles was eliminated in our region in 2016. But as coverage rates dropped, we faced important measles outbreaks in Venezuela, Brazil, Colombia, and in a few of the states of the United States. As we speak, at least 3 countries are working to contain measles outbreaks in Latin America. Efforts to control measles must continue safely amid the COVID-19 pandemic, or we risk erasing more than 20 years of progress. This is true for other diseases and a top priority for PAHO, as many countries have been struggling to maintain high coverage of key vaccines even before the pandemic. Globally, COVID-19 has already impacted immunization programs, interrupting vaccine supply routes, reducing the availability of health workers to deliver immunizations, and hindering access to primary care services. This is a cause for alert. If we don't immunize now, many more people are going to get sick from preventable diseases in the coming months and years. PAHO has issued detailed guidance to countries to help plan and make decisions on which vaccines to prioritize during the COVID-19 pandemic, considering both the potential risks and the burden of the pandemic on their health systems. So we recommend that governments prioritize those vaccines that are most urgent. This includes vaccine for diseases that have an imminent risk of expanding in that area, such as measles, and vaccines that help protect from other respiratory infections, such as flu and pneumococcus. It is important that we find safe ways to deliver vaccines during the pandemic. Many countries are taking a creative approach to flu vaccination in preparation for winter in the Southern Hemisphere. For example, Brazil is reaching older adults in pharmacies and at home. Chile is offering drive-through flu shots. Bolivia is sending out immunization brigades to nursing homes and jails to reach at-risk groups. And El Salvador has set up vaccination stations at banks. Through determination and innovation, we will reach almost 100 million people with the flu vaccine this season. This week, 45 countries and territories are intensifying vaccination efforts in the region. Our teams at PAHO, within each country and here at headquarters, are supporting every step of the process. We are training health workers and educating communities. We are working harder than ever to ensure that this pandemic does not disrupt vital immunization services. The Americas has a legacy of working together to expand vaccine coverage and to eliminate diseases. We have eliminated smallpox, polio, and 4 other diseases. And we, throughout the region, have maintained close to 95% coverage of the basic vaccines throughout the region. Our vaccination programs are the pride of our health systems. They allow us to give our children a healthy start to life, and they keep our society safe from diseases that once sickened millions of people. COVID-19 is putting our health systems to the test. And going forward, the challenge is to ensure that our health systems can deliver on our priority health programs, even while responding to COVID-19. Thank you, and we look forward to your questions.
Muchas gracias, doctora Etienne. Vamos a
Thank you so
comenzar.
much, Dr. Etienne. And we're going to begin now with the questions we've received via email. And then we'll go to the questions from the chat. So don't hesitate to add your questions to the chat, telling us your name and the media you represent. The first question comes from Shamar Neusa from Starbuck News in Guyana, who asks in English.
PAHO's work going to be affected by the United States decision to cut fundings from WHO? Doctora Etienne.
Thank you for this question. I think this pandemic has proven that it requires everyone to work together, be they governments, be they multilateral organizations, private sector, civil society, societies in themselves. And there is a well-used adage during COVID-19 that we are in this together. And I dare say we must add that it is together that we will succeed. And so at this juncture, PAHO looks forward to the continued collaboration with the United States government and with all other partners. To truly appreciate the extent of the effect on the freeze declared by the US, let me give you a little of the PAHO history. PAHO was instituted in 1902, and WHO was instituted in much later in 1948. And the governments of the Americas formed PAHO in response to the many infectious diseases like yellow fever and malaria that was disrupting their trade and their economies. And the US was a founding member of PAHO. And when WHO was formed in 1948, the countries of the Americas, they decided to keep the unique characteristic of PAHO. So PAHO is, yes, the Americas regional office for WHO, but it is a unique organization as well. So we have learned that the freeze has been extended to include PAHO. Over the years, we have enjoyed very firm collaboration and technical support from the US government. They have supported us in health policy development, in the definition and implementation of programs. 60% of the funding of PAHO comes from the US government, and that tells you and speaks volumes. And the work with WHO has allowed us to strengthen immunization programs, and you've heard, leading to elimination of at least 4 of these diseases. It has also been very instrumental in outbreaks and allowing the Americas to face outbreaks. And we've done malaria, yellow fever, outbreaks of dengue, of chikungunya, of Zika, of this COVID-19. Also in disease control, communicable diseases control, malaria, TB, HIV, AIDS, and also their support to us in facing disasters as PAHO works with member states in times of disaster. So the funding from the United States has been really central to the work of the Pan American Health Organization. And I must say that some of the programs that I listed have a direct impact on the national health security of our countries, but also on the United States of America. This mutual collaboration between the US and PAHO has stood the test of many, many years. And it is our hope that we can continue to work in this vein to ensure that health and well-being come to the majority of people in the Americas. Thank you.
Vamos a pasar ahora a la siguiente
pregunta. We're now
pregunta.
going to the next question from Alejandra Berestovsky from La Voz del Interior from Argentina, and a similar question from Mariano Berlina from the Diario El Clarín, also from Argentina. What assessment can you make of the creative systems used by some countries for social distancing? Can they risk the quarantine and the contention? Dr. Barbosa.
Gracias por la pregunta.
Thank you for the question.
Efetivamente, cada país
Each
está
country
adaptando para a sua realidade epidemiológica
is
as
following its
medidas de
epidemiologic
distanciamento
reality,
social. Pero
the
vamos
social
recordar por que
distancing measures
elas
and so forth. But
são
let's remember
importantes.
why they're important.
Porque se derramos
Because
a
if
transmissão
we
comunitária
allow community
acelerar em
transmission,
país, nenhum
it may
sistema de saúde
accelerate in a
é
country, and
capaz
no health
de
system will be in a
oferecer
position
as
to
camas de hospital, as
have the
camas de
necessary
terapia
hospital
intensiva,
beds or
os
the ICU
respiradores
beds
para atender
or
a
the
las
necessary
pessoas. Vivimos
ventilators to
isto
assist the
em
people.
Itália, aqui
We've
em Nova
seen it in
York,
Italy, we've seen it
em
in New
alguns
York,
sítios da América
and
Latina,
other
incluso em
places in
Guayaquil,
Latin
por exemplo.
America, including
Entonces,
Guayaquil,
as
for
medidas de
example.
distanciamento
So
social
the
têm
social
esse
distancing
objetivo.
measures
Se
are for that
país,
purpose.
para poder
For a
planificar
country to
o
plan
relaxamento progressivo das medidas
progressive
de
opening
distanciamento social, tem
of
que estar
these
seguro
social distancing
de que
measures, they must
controlou a
be sure
transmissão.
that they have
E controlar
controlled
a
the transmission.
transmissão significa ter
And
sistema
that
de
means that you
vigilância
must have
efetivo,
an effective
significa ter
surveillance system
capacidade de
as
testes
well
e
as
com
the
todas essas
testing
características
capacity.
não está
And
encontrando
even
transmissão.
then,
E aí
they're
sim,
not
se
finding the
pode empezar uma
transmission.
transmissão
And then they can
planificada,
begin to
empezando
plan
por lo que é
the
mais
opening,
essencial para a
beginning
sociedade,
by what's most
de
essential
maneira
for society,
planificada e
in a
monitoreando
very
o
carefully
impacto que
planned
cada
and
medida
monitored
dessa
way to
se vai
consider the
adotando.
impact of
Essa é
each
uma
one of these
maneira
measures.
que se
This is
pode
the
fazer para
way
uma
that it can
transição.
be
Mas
done.
nesse momento, é importante
But at
subrayar
this
que
point,
em
it's
grande
important to
parte da América
mention that
Latina
in most
estamos
of America,
experimentando
we are
exatamente uma
living
transmissão com
a
um acréscimo de casos, com um
an
acréscimo de
increase in the
mortes.
number of
Então,
cases
há
and the number
que
of deaths.
responder
So we
bem
must
para esse
respond
momento antes de
carefully to be
pensar em
ready
uma
for that
possível
moment before we
transmissão.
even begin to think of controlling transmission. Thank you, Dr. Barbosa. The next question is from Jim Wise from the Miami Herald, who asks, Puerto Rico
counted its coronavirus cases and that the data it was producing wasn't reliable. Ecuador has also added thousands of new cases to its count due to data issues. Have you seen any similar data problems in the rest of the region? In general, how would you characterize the region's ability to gather and communicate its coronavirus numbers? Dr. Espinal?
Thank you very much for the question. I think we have to take into account that in all outbreaks, data will never be perfect. We saw China just revising recently the number of cases and deaths. We have seen also new studies that has come out in the United States in pregnant women suggesting that there is underestimation of cases in New York and other areas. So it's a situation that is affects every country. I think the issue with Ecuador and Puerto Rico, we should commend them because they are revising the numbers frankly and honestly. So we cannot expect that the surveillance will be, remember, we have to remember that there is the issue of testing, available testing for all the countries. This is a pandemic that is globally affecting everywhere. But we are confident the countries are doing their best to test and to report the cases. And PAHO has been working with them from the very beginning. Also remember that countries that had the time to prepare because the pandemic started in China and went to Europe. So the testing issue is definitely influencing the numbers. And revision of the numbers, there's nothing wrong with that. And on the contrary, is good. And at the end of the day, and few months after this pandemic ends, hopefully, we will see revised numbers again regarding number of cases and number of deaths. And this is why today many scientists and public health experts rely on estimates also. Thank you.
Gracias, doctor. Otra pregunta que
Thank you,
viene.
doctor. We have another question coming from the established news from Guyana.
Where is PAHO sourcing equipment like PPEs, testing kits, and even ventilators from to help countries in need? Dr. Valarte?
Thank you for that question. That is an important question because there is a global market failure regarding PPEs, lab tests, and also ventilators. The first source of PPEs from PAHO for the countries in the Americas were sent from our humanitarian warehouse located in Panama, with donations that we received from several institutions, including, of course, WHO and Direct Relief. Currently, we are procuring PPEs from several sources, including Asia, and also from local markets in the Americas. This is a tough situation. There is a global supply chain that is working, and PAHO is part of that global supply chain and using the strategic fund in order to procure those supplies. Regarding the lab tests, we've been sourcing those from Germany and from the US. A clarification is needed because we in the Americas, Latin America and the Caribbean, we are using the protocol that was developed in Berlin. So we are using that. The purchase of ventilators is a work in progress. We couldn't purchase them yet, but we are close to that. Thank you.
Gracias, doctor Ugarte. La siguiente
Thank
pregunta.
you, Dr. Ugarte. Our next question is from Prensa Libre from Guatemala, Ana Lucia Ola, who says, we hear of people who've recovered from COVID. How do we know if they're really free of the virus and what are the sequelas in the body? Dr. Barbosa, can you take that question?
Gracias por la
Yes,
pregunta.
thank you for that
Mira,
question.
la gran mayoría de las personas
Most
que
of the people
tienen la
who have
COVID-19
had
van a se recuperar.
COVID-19 will
Era
recover.
percentaje que va a desarrollar
Small
formas graves y va a
percentage will
necesitar de
develop
hospital
severe
y de
cases, may
cuidados
require
intensivos. Pero la gran
hospitalization or
mayoría sí
intensive
va a
care, but
tener
most
contacto y
people will
va a se
recover.
recuperar. Hay protocolos
There are
para decir que la
protocols
persona
to
está
know
libre del
if the
virus.
person
En
is
general
free
se
of the
toman dos
virus.
muestras
In
para
general, 2
hacer
samples are taken
la muestra por el examen de
to
PCR
do the
y
PCR
después de eso
test,
se
and
considera
then
que la persona no tiene más capacidad de
it's
transmitir
considered that the person is
el
no
virus.
longer in
Cada
a
país
position to
adapta
transmit the
esse
disease.
protocolo
Each
para
patient
sua
is, the
capacidade de
country is
testes,
adopting the
pero em
protocol
geral é
and
assim.
their testing capacity.
La
But in
outra
general,
coisa
that's what
sobre
is being
sequelas,
done.
há
As for the
alguns
sequela,
informes sobre
we've had
pessoas que
some
se quedaram
reports
com
of
alguma
people who
sequela
had
pulmonar
certain
por
sequelas,
período, que requeriram
lung
fisioterapia
sequelas
e
for
outras
a time,
medidas.
who required
Pero isso se está
physiotherapy
todavia
and things like
evaluando,
that.
porque a
But
grande
that's still being
maioria que
assessed
cura,
because
cura e
most of
se
the people
quedam
who
sem sequelas e voltam à sua
improve
vida
had no
normal.
sequelas and
Gracias.
can return back to their normal life. Thank you very
Gracias,
much.
doctor.
Thank you, Doctor. Our next question from Jacqueline Child from the Miami Herald.
How concerned is PAHO that we can lose beds and workers before the pandemic peaks and community spread grows in the region and hospitals find themselves unprepared with either asymptomatic patients or influx of positive cases? Dr. Espinal?
Thank you. That's a key question because, the backbone to fight this epidemic is a strong health system and a strong health services and hospitals. We are concerned, but at the same time, we need to say that countries, we started working with the countries since the very beginning. The outbreak started in China and advising countries. We have epidemiologists, clinical health experts, logisticians on the ground in our offices, helping the countries to ensure the beds and the ICUs or in intensive care units are fully prepared. The countries are definitely preparing. And let us remember that the region of the Americas is not homogeneous. One size doesn't fit all. We have high-income countries, low-income countries, and medium-income countries. So different type of health systems. But one key issue is that they are being creative and innovative. Some of them are using also mobile hospitals to ensure that they are prepared. And the other important thing is that the implementation of the containment and mitigation measures slow the spread of the epidemic. And that will allow the health system not to be overburdened with by needing beds and ICUs and respirators. But of course, our message is that countries needs to keep the actions in place, preparing them until the curve is flattened, and make sure all the centers are fully prepared. And let's not forget also the first level of attention that takes care of other illnesses and diseases. But despite our concern, we are pretty confident the countries are doing their best to ensure beds are available and ICUs are ready to manage COVID-19. There will be sections and things that happens in an outbreak and in every outbreak. Thank you.
Gracias, doctor. La siguiente pregunta viene de
Thank
las
you,
Bahamas.
Doctor. The next question from Bahamas, from Krishna Dibhil. from the Tribune.
What indicator should be present for the Bahamas when considering an appropriate time to open the economy? Dr. Ugarte?
That is a key question. Regarding the impact on economy, we have to remember that all epidemics and disasters cause an economic impact. And we have to reestablish that economy as soon as possible. But at the same time, we have to recognize that there are several indicators that we need to follow, or conditions. One of them is the capacity of the health services to absorb the demand that will cause another transmission of COVID-19. And the other thing is to identify those cases, the capacity to identify, isolate, quarantine the contacts, etc. And the other aspect is that we need to follow which are the populations that are more at risk. And of course, we have to have all the means to control those outbreaks. So in that regards, it is a question that must be applied to the reality of the country, and in some countries also applied to certain locations, certain areas inside the country that will need a different approach. Thank you.
Gracias, doctor. Siguiente pregunta.
Thank you, doctor. The next question comes from Mike Wesenstein from Associated Press, who asks,
the large number of cases in Brazil and relatively few control measures, are you worried about Brazil becoming a reservoir of COVID that keeps reinfecting neighboring countries that have tighter measures? Dr. Aldiguieri?
Thank you for the question. You know, all countries of the Americas have reported laboratory-confirmed cases. Most of the countries and territories of the Americas are reporting death related to COVID-19. We have a mosaic of epidemiological patterns in the Americas with different patterns in North America, Central America, South America, and the Caribbean. The trends should be monitored in country by country, but also at the subnational level. And I would say it's the most important aspect in order to customize, adapt, reinstall the public health measures, including social distancing, for impacting on the curve and to flatten the curve. Important measures are also related to international and domestic travels. So we have hotspots in the region, in some areas in the region at the moment. Public health authorities are taking the measures and are implementing stronger measures or lessening the measures. And the aspect of transborder impact is managed through the closer collaboration between countries in border areas. Thank you.
Gracias, doctor.
Thank you, doctor. And we remind you that you can continue to add your questions to the chat. The next question is from AFP, Juan Serrano, who asks, what do we know about the people's immunity who recover from the virus? Do we know what strains of coronavirus are circulating in the region?
Una pregunta muy importante, pero que tiene varios ángulos.
But it has several angles.
La inmunidad de las personas tiene dos principales tipos de inmunidad. La respuesta inmunitaria innata o natural y la respuesta adaptativa, la que se adapta en la presencia de un virus. La razón por la que no tenemos la respuesta para todas esas preguntas, incluyendo la situación con los famosos pasaportes, la OMS ha llamado la atención, si le repite a las personas, tiene que
whether
ver
it
de varios
repeats on the
ángulos.
person or
Primero,
not comes from
no
several
tenemos un
angles.
año
First,
calendario con
we
todo
don't
esto.
have
No
a
hemos
calendar
visto
year of
cómo
this yet.
evolucionan
We haven't seen how
en
it
muchos de estos
actually
casos.
evolves in many of these
Segundo,
cases.
tiene
Secondly,
también que ver con
it
la
also has to
situación de
do
los test,
with
las
the
pruebas rápidas que a veces nos
rapid
dan falsos
tests, which
positivos
sometimes
o
give us
falsos
some false
negativos.
positives
Y
or false
tercero,
negatives. And thirdly,
el nivel de ataque del virus.
level of
No es lo
attack
mismo
of the
una
virus.
persona
It's not the
muy
same.
enferma.
If you have a very sick
Lo que se
person,
está viendo es que las
and
personas
what
más
we see is that
enfermas
the people who are
desarrollan
getting
inmunidad
very
más
sick
tardía.
develop a
Ahora, no
later immunity.
significa que la
That doesn't
inmunidad va a
mean
ser de
that
por vida.
immunity is going to
Si
be for
tomamos el
life.
ejemplo de los
If we
demás
take the example
coronavirus,
of other
hay 6 otros
coronaviruses,
coronavirus.
there are
4
6
de
other
ellos producen
coronaviruses. 4 of them
la gripe o el
will
common cold,
produce the
como
common
decimos.
cold, as we call it.
Y estos
And
pueden
these
repetir,
could be
pero
repeated,
esta es una enfermedad
but
sencilla.
this is a
Sin
simple
embargo,
disease.
si vemos los
However,
estudios que se
if
han
we
hecho con
see the
SARS,
studies that
el
have been
virus
done with
SARS,
SARS,
que es un primo del coronavirus
which is a
actual, del
cousin of the
COVID,
current coronavirus of the COVID,
la inmunidad puede durar
the
1 o 2
immunity could
años.
last
Entonces,
1 or 2
no
years.
podemos
So
descartar
we can't
que pueda
discard
volver a
the
repetirse.
possibility of
Esperamos que
it
la mayoría de los
repeating again. We
casos
hope that most
resulten
of the cases
inmunitarios, pero
will
también se ha visto
be immune, but
pacientes
we've
o
also seen
personas
some
que
patients or
han
people
resultado
who've
enfermas muy leve
been
que
had
podrían
a
volver
very
a
mild
repetir
case and could repeat
se han
infection.
hecho experimentos en monos
Some tests have been done on
ya,
monkeys,
y lo que se ha
and what
visto
we've
es que la
seen
respuesta en
is
mono es
that
fuerte. O sea,
response in the
es
monkeys
una
was
pregunta que
strong.
no podemos
But
tener
it's
todavía
really a
la
question
conclusión
we don't
final
have
y
a
el
definite answer
tiempo
for
nos
yet.
dirá, y
Only
los
time
estudios de
will tell us,
investigación que se
with
están
the research
realizando,
studies that are
nos
being
dirán
done,
la respuesta
what the
más adelante.
actual
Muchas
answer
gracias.
is later on. Thank you very much. Thank you, Doctor. The next question comes from the chat and an email that we received from Gabriel Matista from TV Venezuela and Mariana Saupet from Efecto Cocuyo from Venezuela, who ask, what is the true situation of the health system in Venezuela? And Mariana asks about the tests. We don't know the exact number of PCR tests or suspicious cases. We only know that Venezuela has only one center that has a PCR test. What has PAHO asked the authorities to do? Dr. Ugarte, can you answer that question? Thank you. It is a very important question. Countries must report confirmed or suspicious cases of COVID-19, and that's being done through the HRS systems. They're not forced to report the number of tests or the type of tests that are being done, but the Venezuelan reports appear in the media, and the coordination is done through the multi-institutional mechanisms through which PAHO participates. As to the health systems question, I could say what the systems were like before. And based on that, when there is a large number of health providers who've left the country and the deterioration of the health systems, the challenge is very serious for Venezuela. And the possibility of recovering those health systems in case of an increase in the demand, hopefully they may be in some way ready to respond to ICU needs or serious needs. And maybe a national detection system should be implemented to take samples outside of Caracas, where the National Health Institute is located. That is being done, but as you can understand, the transportation due to the situation is also difficult, and that means that there is a very high delay. Thank you very much. This is from El Universal from Mexico, and also a similar question from Isabela Gonzalez from the Reform from Mexico, who asked, in Mexico, it's been 2 months since we had the formal beginning of the COVID-19 emergency. Do you believe that the country has controlled the disease? How do you see the response in Mexico compared to other countries?
Gracias por la
Thank
pregunta.
you.
Pero todos los datos de México
From
de país, de número
all
de
the data
casos,
from Mexico,
hablan que
we hear
la
that
pandemia de
the
COVID-19 en México
COVID-19 pandemic
sigue
in
com
Mexico
a mesma
continues
característica de
with
outros
the
países de
same
Latinoamérica. Como
characteristics of
empezamos
other
a
countries in Latin
transmissão
America.
mais tarde
The
que
transmission
Europa,
began a
nós
little
outros
later than
estamos
in
como se
Europe,
fosse a
and
Europa
therefore
há 6 semanas
we're
atrás.
like Europe
Então,
was
em
about
México,
6
em
weeks
Brasil, em
ago.
Peru,
So
em
Mexico,
Equador,
Brazil, Peru,
em
Ecuador,
Argentina, em Chile,
Argentina,
todavia
Chile are
lo
all
que estamos
still
monitoreando é o crescimento de los casos
seeing
y
a
lo que se
growth in
puede
the number of
esperar
cases,
para
and what
las
can be
próximas semanas
expected for the next
el
weeks
crecimiento del número de
is a
casos. Por
growth
isso
in
é
the number
muito
of cases.
importante,
That's why
por
it's
isso
so
é
important
importante que os ministérios de
for
la
the
salud, os
health
gobiernos,
ministries
sigam
and
sin bajar la
governments
guarda
to
com el
continue
monitoreio, com as
monitoring
medidas de
and
distanciamento
controlling,
social, com a
continuing with the social
preparação
distancing
e el
measures,
fortalecimento de la capacidade de
strengthening
sus
and
hospitales y sus
preparing their
servicios de
hospital
salud.
capacity
Essa
and
é
health
a
services.
realidade do país.
That's the
Seguro que
country's
um
reality.
país
I'm
de
sure
grande
that
como México,
a
como
large
Brasil, como
country like
Argentina,
Mexico
como
or
Peru,
Brazil or
a
Argentina or Peru
situação subnacional é
has
distinta.
a
E
different
aí cada
situation
autoridade nacional
subnationally.
está a revisar cada
They have
província,
to
cada
check
estado
the
como está
provinces and the
o
states to make
comportamento.
sure
Pero
how COVID is
el promedio
behaving.
del
But
país,
on
de los
average in the
países de
country,
América Latina y
most
México también,
all countries of
está
Latin America
crescendo a
are
transmissão
seeing a
todavia
growth
e por isso
in
que
the
há que manter
transmission.
o
That's why we
distanciamento
must continue
social
with
e
the social
fortalecer os
distancing
serviços de
and
saúde.
strengthen the health services. The next question comes from Nicaragua, from La Prensa, from Roy Moncada, who asks,
of the situation in Nicaragua with respect to COVID-19. Dr. Ugarte?
That is also an important question. Our country office is providing continuously all information and technical guidelines that are available both from WHO, but also the technical guidelines that PAHO develops according to the situation in the Americas. So we've been also providing supplies, personal protective equipment, lab tests, etc., to the laboratory, and also training to the laboratory of Nicaragua. The Ministry of Health is participating in the regional meetings of the ministers of health, both with PAHO, but also with WHO, and they are reporting through the channels of the international health regulations. So the information that we have is regarding that information that the Nicaragua is reporting through that one. And I mentioned previously that that is the channel that the government of Nicaragua is using currently. Thank you.
Gracias, doctor. Siguiente
thank you,
pregunta.
doctor. The next question comes from Miguel Luna from La Octava TV in Mexico, who asks, the use of masks is indispensable for the population as a way to reduce contagion, or only for the medical staff and the sick people? Dr. Espinal, can you answer that question?
Debemos tener muy
We
claro
should
que el
clearly
uso de
recognize that the use of
cubrebocas o
the
mascarillas,
masks,
la prioridad número uno son
top
los
priority is
enfermos
for the sick
y los
patients
trabajadores de salud,
and the health
médicos,
workers,
enfermeras,
physicians,
pero no solamente los
nurses,
trabajadores de
but
salud que
not only
están
the health workers who
trabajando
are
en COVID.
working
También
with
recordar que
COVID.
hay otras
Let's
enfermedades
remember that there are
y
other
están dentro de los
diseases and they're
hospitales.
in the
Entonces,
hospitals.
de ahí la
So that's why we
prioridad
should
de que
definitely
las
give
mascarillas
priority
se reserven para los trabajadores de
to
salud y para los pacientes.
for the use of the
La
mask
segunda
for the
prioridad
patients
es
and the health workers in
para
general.
personas
The
que
second
cuidan de
priority is
personas
people who
que
take
están en
care of
recuperación
people
o
who
que han
are
estado enfermas.
recovering and who
También hay
have
que
been
tener en
sick.
cuenta
We
los
must
lugares
also take
cerrados
into
con
consideration closed
poblaciones en situación de
spaces
vulnerabilidad,
for
como las prisiones,
vulnerable
como
situations like
los asilos,
jails,
casas de cuidados. El
older
uso en la
patient,
población,
elderly homes,
las investigaciones deben hacerse.
The
Ahora bien,
investigation has to be done.
si se puede utilizar otro tipo
If you can use other
de
types
cubrebocas,
of
pero
masks,
no está mal,
wonderful.
pero
That would be
preservar
great.
las
But
mascarillas
the
recomendadas para
masks that
los
are
trabajadores de
recommended
salud
should be
y
kept
para los
for the health
pacientes
workers
enfermos.
and the
Muchas
sick
gracias.
patients. Thank you very much. Next question from F. Guillermo Garcia Vallascar. There are indications that temperature may in some way affect in transmission. How can the drop of temperature in the southern hemisphere affect?
Gracias por la pregunta. Mira, el
Thank you for the question.
COVID-19, las evidências que temos é que é
from what we've
capaz de
heard,
produzir brotes
may
importantes
produce
em qualquer
important
país, em
outbreaks
qualquer
in any country
temperatura. havia
any
a
temperature.
princípios, eu creio que muita
Initially,
gente que
many
pensava
people
que
felt that
la transmisión más fuerte se iba a
the strongest
concentrar
transmission
en
would
los países
be
de clima más temperado. Eso
in the
no
countries
pasó.
with a warmer temperature,
Entonces,
but that
todos los
didn't happen.
países tienen que estar
All
preparados
countries have
y
to be
responder
prepared
de maneira
and
adequada,
must
porque não há
respond
nenhuma
appropriately
proteção
because there is no protection
que se tenha evidência até o momento.
that we know of.
O que pode
this far.
passar é que
What could
durante o
happen
período de
is
inverno,
that
em qualquer parte,
in the
como há
winter,
uma transmissão mais
since
forte
there's a
pelos
stronger
vírus
transmission
respiratórios,
of
também
respiratory
aí se pode
viruses,
acelerar a transmissão do
the transmission
COVID-19.
of COVID-19
Pero
may be
todos os
accelerated,
países
but
estão com a
all countries
identificação de casos, com a
are
identificação de
seeing an
brotes de
increase in
transmissão
the number of
comunitária, assim
cases
que
and in
é
the number
melhor
of community
sempre
transmission. So
em
it's
saúde
always
pública
better
preparar
in
para o
public health
pior.
to be
Ou seja, os
prepared
países que
for
todavia
the
não
worst.
têm
The countries that
transmissão
still don't
comunitária
have community
disseminada
transmission
em las Américas
in the
devem
Americas
se preparar
must
e
be
continuar
prepared,
com os esforços de
continuing
detectar
with
os
every
casos,
possible
aislar,
effort, detecting
detectar os
cases,
contatos e
isolating,
preparar
detecting
os
contacts,
serviços de
and
saúde, porque
preparing the
podem
health services
ter
because
no futuro
they
transmissão
may
comunitária.
have community transmission in the future. Very well. Thank you very much, Doctor. The next question coming from the chat. We only have very few minutes left. The next question is from Barbados Today, Marlon Madden, who asks,
The Eastern Caribbean seem to be managing the COVID-19 pandemic effectively. What are your thoughts on this section of the region and what lessons are there for others? Dr. Ugarte, quizás?
Okay, thank you so much. The Caribbean has been responding to this in a very cohesive way. And all the previous preparation and the coordination among countries is paying off. Not only in terms of deciding together which are the approaches, but also in terms of strengthening their capacity and sharing their resources in a scope of solidarity. And I think that is the main lesson that we have to learn. This pandemic represents an opportunity to show our solidarity with other countries. Of course, the governments have to look inside their own countries, but this pandemic is beyond that. So this is something that we have to learn from the Caribbean, from the ECC countries. Thank you.
Gracias, doctor.
thank you, Doctor. We continue to receive questions, but we're going to take only the last question for today now, which is on softening the measures, which comes from Leonardo Batista from La Jornada in Mexico, and a similar question from Jessica Gramajo from Soy 502 Guatemala and Channel 2 in Bolivia. And they ask, at what point of the disease can we begin to soften the containment measures, and how should it be done? Dr. Etienne, would you like to take that one?
Thank you, and let me thank you for this question. Following a period of social distancing, any attempt to transition to more flexible measures should be taken with extreme caution. This has been emphasized both in the CDC guidelines and in the WHO guidelines. Such decisions should always be informed by the disease transmission patterns, by COVID testing, contact tracing capacity, the availability of hospital beds, and other objective criteria. And so surveillance must be strengthened to ensure that there is adequate monitoring of this criteria. I think it's important that we must also draw lessons from countries that have transitioned and are now transitioning. Social distancing needs to be accompanied by comprehensive social support measures to ensure that the most vulnerable can comply without severe risk to their livelihoods. Of course, this is extremely difficult in some countries. This will require an adequate national and local logistical capacity to ensure the delivery of medicines, of tests, of food, and other supplies for our populations. Implementing the measures required to stop COVID-19 can be very disruptive, and we understand that. But failing to do so will risk prolonging the crisis. Interrupting recommended social distancing too early could also have the opposite effect and lead to a second wave of COVID-19 cases, extending the suffering and the socioeconomic uncertainty. As lockdowns in parts of the world ease with declining numbers of new cases, we continue to urge countries to find, isolate, test, and treat all cases of COVID-19 and trace every contact to ensure that these declining trends can continue. Indeed, together and with determination, we can face this pandemic and we can begin to contain and further spread in our region. Thank you very much.
Gracias, doctora
Thank you,
Etienne.
Dr. Etienne. And with this, we've come to the end of our briefing today. We will send the opening words of Dr. Etienne to you soon, as well as the recordings of this session. We apologize for not being able to answer all the questions today, but you can continue in contact with us through the email, and we'll be sure to answer them as soon as possible. Thank you all, and we'll see you next Tuesday.